Hey, what's up, YouTube? This is your guy, Antoine, again. This video today is a direct appeal. I want to talk directly to the men out there who have either recently or, sometime in the distant past. Have you ever gone through testing and received a diagnosis of prostate cancer? Or are you at that point, that stage right now, where you're hearing the words for the first time from your medical staff that you have prostate cancer? If that's you, if you're like me, you're probably at a point of, okay, I've got prostate cancer. What now? Like, where do we go from here? Like, what does this mean? There's probably a million questions in your head. We're not going to address a million questions, but we are going to talk about it. It is a space that you go through, you go through, but you can get through it. We're just going to talk about some of the things that are involved with being in that space. So if that's you, stay tuned. Let's sit down. Let's talk about it. See you inside. All right, everyone. Welcome back to my channel. And as we kind of disclose in the opening, you've gotten to the point of a cancer diagnosis. Now what? And I know that's a looming kind of question. That now what? That's something is going to be there for most folks. This is a brand new experience. For most men, it's something that you did not expect to hear, did not anticipate, don't know anything about. It creates a lot of anxiety and creates a really huge space. And as far as what's considered that now what stage, because you don't know what's next. What do you do next? What's to come next? You're gonna have a million questions, like we discussed before. Some of those questions are, you know, is there going to be any pain involved? What kind of treatment will I need? Can I afford the treatment? Does my insurance cover those things? Am I going to die? When am I going to die? There's a whole lot. It's going to, trust me, it's going to go through your mind. Um, and the key thing to remember is that at this stage, you're going to have more questions than you're going to have answers. And guess what? That's okay. Because, like I said, unless you have the advantage of being a doctor or someone in the medical field that's around this or deals with this kind of thing, it's brand new to us. So it's okay to be in that space of now what? What do I do? What am I going to do? How am I going to handle this? And guess what? Also, you're justified in however you need to handle that. That's up to you. For some, it might be, rash emotions. Um, it might be a cry. It might be a hug. It might be quietness, stillness. Some might react in a way of, well, if this is where I am, I'm going to make the best of what I got left. No judgment here. This is a no judgment zone. Um, you're entitled to feel the way you feel. The only thing I would encourage you to do is to involve prayer and allow God into that space, because trust me, in most cases, it's going to be a situation you're not equipped to handle on your own. Uh, so having that established prayer life will definitely come in handy. But if you don't have one, or if yours is not that strong at that point, again, no judgment here, but I can promise you that's the time that you want to develop one. No matter where you are with it, you're going to need a powerful God. And I can't think of a better one to be in your corner than the one we got access to. So tap into that. But again, some of the questions that are going to be looming, you won't have immediate answers for as well. But this is a time also when it's important that you get second opinions, get advice. Part of my desire to develop this channel and kind of have a medium to be able to discuss some of these things grew out of being in that space, that now what space. Because as I said before, when I got my diagnosis, and that being a prostate cancer, and you know what it means for me in particular, and men and black men, beyond that, it's like I ran into a brick wall with information, like being able to obtain information. Um, you know, Parents didn't really have an understanding or knowledge base for it. Friends didn't, brothers didn't, uncles. So, it was a lot of kind of spinning around with no direction, and no real help in terms of being able to kind of be a point of knowledge, or kind of a sounding board to kind of talk to someone that's either been through it. Because, like I said, that was at a real limited on a real limited basis in terms of being able to have access to people either had the information, um, or had the information but weren't willing to share it because of the nature. And again, I get it in terms of some of the hangups with being able to discuss it, but at some point, and I feel like I'm okay to say this, being a patient that's gone through through this process, we got to get past it. We just simply got to get over it. The hangups, the stigmas about why you don't want to talk about it, the uncomfortable nature, all that stuff's justified. You know, One of the other things that made my experience so I'd say memorable. One of the things I remember most about my experience was the conversations that I had to have. Again, especially at least in my case, it was a high risk situation. So there wasn't a whole lot of time to kind of process and, chart out how I was going to address these things, how I was going to make the decisions, what decisions I was going to make. But in the midst of my situation, I had to also consider the conversations that I had to have. I had to, speak to my wife, or conversate with my wife about, what we had just been told or delivered to us. Uh, Together with her, we had to come up with how to best, tell our kids. And, in the back of my mind, I'm also, thinking a lot about how this is going to impact them, being black men. There's some things they need to know. Some things I don't really have the luxury of choosing not to share with them, because that to me is just not fair. But again, those conversations with my parents, um, telling them and sharing those things with them, and considering them in some of the decisions I made as well, how they'll be impacted. So it's a lot. And like I said, I don't mean to sit from a place on high and say that, you know, those decisions, those things that you're going to have to go through, they're going to be uh, easily achieved, because they won't. In most cases, they will not, especially when there's family, there's other people involved. You know, uh, it's a lot to say the least. But like I said, again, prayer, and knowing that there is a God that can conquer all. And to him, these are small molehills. We set them up as a mountain. We don't have any idea how we're going to overcome it, but the reality is that he's done it before. He's currently doing it, and he'll do it again. We just got to get dialed in and get on his level. Um, but again, those are, before you get too, what I would caution you, before you get too deep down into the rabbit hole of questions and woe is me and what am I going to do and how am I going to do this. Before you get there, just take a break, take a breather. Uh, Certainly what I had to do. And what you do in that breather, prayer has to be the first thing. Just get connected. But then beyond that, look at the look at your situation from an individual view, and start from where you're at, not where you'd like to be, not where you could be in terms of your prognosis, but start from where you're at, what you've been told, what your situation, your individual situation is, and just kind of go from there in terms of the treatment options that are presented to you. Uh, Start researching. And that's what I had to do is, I definitely went through a period, even as condensed as and quick as my turnaround period had to be. For my presence of mind, I still had to go through a process of uh, kind of looking at these options that they're presenting to you. Because again, this first time you've probably hearing some of this information, and you just kind of want to verify, what it is and what it'll mean for me individually in terms of the treatment, what kind of side effects are involved, how does it change or affect your prognosis, what kind of pain, what kind of time, how would your job handle it? So like I said, it's a whole lot of stuff, but just taking that moment to kind of breathe through it, realize that you are where you are, and there is a way through it. Not necessarily that your prayer should be to get you out of it, but you're in it is where God has you at the moment. But just understand that He can help you through it. So that was kind of the way I approached it. Like I said, the things that we discuss or I discuss, kind of on this channel, I don't ever want them to be viewed as the gospel in terms of what I'm insinuating or imposing on you as to way your journey should go. But I just need you to keep in mind that this is just an opportunity for me to kind of share, release, and get some of the information out to you guys, just to let you know that there are options. You're not in this thing alone. There's people that have been through it, that are going through it, and that will go through it. So it's key to remember those things. But after taking that breather, just really take a look at what you're dealing with. In this specific case with prostate cancer, I had to say first, like, what is prostate cancer? Like, yeah, I've heard cancer. We all have heard, horror stories, success stories about cancer in general, but what exactly is prostate cancer? So the first thing, obviously, you find out is that only men get it. Didn't really know that, and again, because I never really had to think about my prostate, I didn't really put together immediately that it was only something that men had. But once you get past that, knowing what it is, and it's just a form of cancer that generates from the prostate or the prostate bed or area, and uh, you know, based on when you're diagnosed or how soon it's caught. Hopefully, that is at a point where it's still contained either in that prostate or in that prostate area where it can be. It just opens you up to so many more options in terms of treatment or ways to approach the cancer. So that's going to be key in terms of that. But just the realization that it's just a group of cancerous cells that are forming there, and the key is just to approach it early, to detect it early, and be able to um, keep it from going outside of the area into other parts of the body, the blood, the bone, that kind of thing. So that would be the overall goal. the next thing I had to kind of ask myself is, or kind of research more is, all right, now I know it's prostate cancer. I know kind of what it is, but what is the prostate and what does it do? Like, do I need it? Is it something I need to worry about? So, and again, that's going to be relative to each individual man that's going through this situation. But in a nutshell, the prostate is just part of our reproductive system and located, in the pelvic area. So, again, that's part of that taboo about why we don't want to talk about it, because of where it is, kind of what it does. It sits in an area that's, again, in the pelvic region, um, near your rectum, right near your bladder. So all in that centralized area, and it actually encapsulates your urethra, which uh, transports urine from your bladder out of your body. So, and that's why one of the reasons why when some men complain about problems with the prostate or to discover that they have problems with the prostate, one of the key factors is that they notice a difference in the way they urinate. Because once there's issues with the prostate, and it might not necessarily be cancer, but it could be a situation where you've got an enlarged or swollen prostate. And once it swells, it contracts around the urethra and makes it more difficult to urinate. So that could be something to look at too. And that's why for years, that's what they're doing with the finger check is, you know, checking the size and position and everything of the prostate. And that's why, again, so many men opt not to have it because they don't necessarily want a finger check. And again, I get it. However, keep in mind, we got to get beyond that. But, knowing those things, it, again, that's just some of the things that I had to kind of consider. What is the prostate? What is prostate cancer? Where is it located? All those kind of things. And again, remember, as you're going through this, what I'm kind of articulating now at this point is stuff that I'm able to kind of recap or revisit with you guys. But at that point, I'm still at the stage where I had more questions than I had answers. And there wasn't a whole lot available to me in terms of, you know, feedback that I could get from sources that I knew. So again, that's one of the desires of starting this channel and kind of starting this process, this movement, we'll call it, is to hopefully change that tide, to make it to normalize the conversation a little bit more, uh, so that it's not such a taboo topic, and one that we can kind of the only way we can grow from it is to share. We've got the information, we've got exposure to the information through things like this, but we've got to share it. So hopefully that's what we can do from that. Um, eh, you know, Beyond the things that we've already discussed, also in that now what phase, one of the things that you're going to have to consider is, beyond knowing what prostate cancer is, where it's located, what it affects. Um, and before I go there, in terms of what it affects, obviously some of the bigger things again that add to that taboo nature of the topic is that it obviously can affect your sexual performance, your reproductive ability, um, the way in which you use the bathroom, your ability to use the bathroom, to both urinate and your bowel movement. So all of those things are going to be considerations. So, but beyond those things, it's at that point that you got to start looking at next steps. So yeah, you've gotten this information on what it is. This is where you are with it. You've talked about things like your risk level, where they kind of assess. Um, we've always heard for years about these stages of cancer. Like a person got stage 2, stage 4, what that means. That's still relevant today. However, in modern medicine, they're not only using or setting kind of where you sit at stages, but they also use what's called a Gleason score, which kind of evaluates not only how advanced the or pronounced the cancer is, but also takes a look at the cell development, down to the shape of the cells and what they might do one shape versus another. So they assess those things and they come up with this score that they call a Gleason score. That combined with like what stage they feel like you're at, combined with things like your family history, uh, past medical history, and they compile all these things to kind of assess where you are and what you do. That's why my situation, all those things being considered, I was considered a high risk situation. So again, prayerfully, your situation won't be that. And there's certainly been situations far more advanced than mine. So um, again, just I say that to say that there is hope for me. There's hope for stages that were beyond me, and there's hope for you. So, but in looking at those things, some of the next steps that you might hear tossed out could be things like getting a biopsy. The biopsy is helpful to that's simply where they take a tissue sample on that organ, in this case, the prostate, to see, the presence of the cancer, where it's located. You might have to undergo scans like MRIs or a PET scan. I had to have several PET scans, which is kind of a combination or more pronounced version or advanced version of the typical scans that they do, but this gives a more detailed look, kind of a 3D look or cross section look of your body or the section of where the cancer is located. And it gives all those things together help to give a better idea of kind of pinpointing exactly where the cancer in your case is located, how much it's progressed, if it's metastasized, meaning that it's gone outside of that organ, outside of the prostate, and into other areas of the body. So they're able to ascertain that through the series of tests. Um, so any number of things might be included uh, right after diagnosis. So you've been diagnosed. Now you kind of had some time to kind of uh, fill it out to where we are, what it is that you're dealing with. Now it's kind of time to look at options in terms of treatment. Uh, the key thing that I'll say with that is it's way too important. And again, I'm not passing judgment on anybody or anybody's decision, but I will say this is far more important, far too important to just let it go unchecked. And I'll just kind of put it that way. As my doctor, my urologist at the time explained to me, far too often when he's at the point of having that conversation that, yes, you've been diagnosed, you have prostate cancer. Again, you're sitting there having that conversation with a man that is getting that news but has no symptoms, no pain, especially no pain. um, they're looking at those options a little bit different. Like, do I really need, am I really willing to do X, Y, and Z if I haven't had the first bit of pain at all? Maybe that's something I can put off or, whatnot. So but I would encourage you to not let that be the option. Look seriously at where you are, what the options are, and how best to address it. Now, I won't I won't impose any type of treatment over another, because again, that's an individual situation and it does vary from person to person, depending on what level of severity uh, you might happen to be in. So that's an individual decision that you'll still have to make. I'll just say make a decision though. Don't opt to ignore it or pretend that it'll go away, because it won't. And as it was, kind of relayed to me, We can have the conversation now. We can make the considerations now. We can, take the opportunity now to address it, or we can't ignore it. You'll be back because it's not going to stop. It's an aggressive form in black men for any number of reasons that are there medically. This cancer attacks us much more aggressively than it does the rest of the population. So it's not enough to say let's just roll the dice. Like I said, I won't impose one way over another, one treatment over another, but I will say address it, however that looks like for you and your team. But address it, and then like I said, pray on it, get some guidance that way, get the information you need, collect all that information, surround yourself with people that love you and care about you and that can assist you with making that kind of decision. And then, go for it. But just don't close yourself off and think that, well, this thing's going to go away. Just don't tell anybody and you pop up later and, you know, um, that's just not a good situation for anybody involved, namely yourself. So, just address it. This thing, like I said, it's a lot with it, and I get it. And I've come a long way personally with even being able to share this with you guys. So I know I know what you're going through. I can say that wholeheartedly. I know kind of some of the feelings and some of the things that might be going through your head. But I promise you, there is light at the end of the tunnel. Uh, However that looks for you, and the timeline might be different. I can't say what you'll have to go through to get there. Um, we're just kind of starting this journey in terms of the sharing process that we got going here, and I promise you, there's a lot to my story, and I'm sure there's a lot of stories out there that are even far greater than mine. But as far as my experience and what I was prepared to handle, um, it's a lot. It's a lot involved. So I get it. I understand, and I just need you to know that you're not alone. Like I've said before, it's a lonely space to be in to get that diagnosis, to try to confide in people that don't, like myself, don't know anything about prostate cancer, or where to go, what to do, who had it, what I did, because they either have it um and are not willing to, or are not willing to share it. So it can be a lonely place, but just know, like I said, there are ways out, and there's ways through. um so just hang in there. You'll be okay. But again, not to hold you guys too long today, but did just want to come back at you. And one of the things too, I want to ask everyone is to start giving me some feedback. And again, not necessarily looking for uh, you know you suck at videos, or you speak kind of whatever. That's not what I'm looking for when I say feedback. But feedback on if you think this is something that's helpful, if you have anything to add to it in terms of your story, your experience, or how it may vary or different from mine. Because remember, I'm not a medical expert. I'm just kind of telling you my experience, how I approached it, how things, mm, how things made me feel, um, and just my journey through this thing. So, but I encourage you, especially those of you that may be viewing by way of phone, your phone, go in the comments, send me a message. You know, Certainly words of encouragement are always appreciated. But if you could, just so that we can continue this thing, just like it, just like the video, share it if you feel so compelled, and certainly subscribe, so that as I do more videos, you'll be notified and we can kind of get these things out. You can kind of share them. That's how the thing will grow. And again, not that I'm looking for anything out of this other than getting it to as many folks as I can. And while I say I'm kind of directing it more so at Black men, because that's what I know, that's what I am. And I recognize the disparity in the information and the things that are available to us. I don't want this to be limited to just Black men. So, because even beyond the men that hear this or need to hear this, there's a whole nother segment of your children who may or may not be male kids. You can have certainly your spouse or significant others that are going to be critical in knowing this information as well. So, because when you get that news, uh, the people closest to you are going to be your first go to. So the more they know about it, so like I said, don't feel like you're obligated to only share this with Black men. I'm past the point of kind of holding this stuff in, and certainly as God will allow me to share, as He allows me to share, and how He guides me in this sharing. I'm just going to ask you to share it because, like I said, there's certainly it goes beyond the scope of just the Black man. There's a lot that goes into our care because I promise you, every doctor, every nurse, every technician that runs your scans, every person that brings you a tray of food at the hospital, they're not all going to be Black men. So there's a whole group of folks out there that need to know and should know about the ins and outs of prostate cancer, and more importantly, how it affects us as Black men. That can help in terms of the care and helping us, get over this thing because it's something that we can overcome, we can beat, and I'm hopeful for the things that are in the future to come. I'm looking forward to all the great comments, all the words of encouragement, and I hope that I can be a source of encouragement for you guys as well. So, again, I won't hold you anymore today. I thank you guys for tuning in to another video. Hopefully you made it to the end of this one. Again, just like, share, and subscribe. I look forward to seeing you guys on the next video. Peace.